and he couldn't accomplish what he wanted to accomplish with a PhD in biochemistry. So he decided to go to medical school. Now, those of you who were around the medical profession at that point in time knew that you could not get into medical school in the United States unless you had a father who was a doctor or a 4-point or whatever, he had a lot of pull. So he went to the University of Guadalajara, Mexico, got his MD, came back to Rush Presbyterian Hospital in Chicago, where he did his internship and his internal medicine residency, and then he did a cardiology residency too. I'm a med tech. I've spent most of my adult life in the medical profession, but he is the most brilliant man that I have ever met. And I don't know about you, but I have a whole ring notebook out in the hall that I'm going to run and get, because last time he talked on flavor, which was a new subject, and I had reached the stage where I don't have to take notes anymore. I've heard him so many times that I sort of know what he's going to say. I had writer's cramp when it was over. He's never talked on tonight's subject of hormones and its effects upon our body. And tonight I know I'm going to have writer's cramp again. So please give a warm Wisconsin welcome to one of the neatest people in the whole world, Dr. Mohamed.
How many new people here tonight? Okay, we have about 25 people and a half. Well, the lectures for the new people here that all my lectures I prepared when I'm sitting in the last minute to see what I'm going to be talking about, because if I do it ahead, 5 minutes ahead, I change my mind again. So when you have so much knowledge and medicine and nutrition and you start to speak and you try to encapsulate something in an hour and a half, it becomes very difficult because there's so much knowledge to share. I can stand right here and speak about only one hormone or one gland for 3 hours non-stop, and it will be still an interesting lecture. But tonight we decided to put this lecture that speak about different subjects, all of them related to our hormones. Before I take I'm not going to take any time to discuss previous lectures or anything like that. We just go ahead and move and talk about the main topics of the lecture, which is the role of the hormones in our body. Remember, all these lectures are related to nutrition. Hormones and nutrition always working together. The study of the hormones, you try to understand what the word hormone means. A hormone is a substance that the human body makes inside. That substance is the most potent and powerful material the human body makes. To study the human body, you have to understand one thing. It is important to understand the hormones, to go back to the very beginning, how we were created as children, and how does the hormone play a very important role in our growth. And then after we grow, how does the hormone stabilize our life and keep us young and healthy? And then how those hormones, when something happens, go wrong with them, lend us to the nursing home if we are not careful. Okay, this is the main thing we're going to be taking a trip all the way together through this hour and a half. If you want to study the hormones, you're going to start with the very beginning of human life, which starts with an egg from a woman and a sperm from a man. Both of them, you going to join us? Okay. We'll wait until he then. Okay, those... What do we do to the parking lot? Those two cells, they have genetic codes inside. Inside the woman, right here, this is the uterus, and this is the ovary. The ovary secretes egg which migrates down here, which made for one cell. In the meantime, the testicle secretes is black or white, tall or smart or stupid, whatever color is, falls inside that sperm. In the meantime, the same thing in the woman right here. And when both of them will meet, then we have a new human being. How this could be created? The sperm has a long tail behind it so he can swim. And then he has two motors right here. In case of the tail doesn't work, he can push himself through. And they all come right here, 600 million of them. Okay, 600 million, they're hitting each other in each direction looking for this tiny hole. The funny thing about it, the interesting thing about it, the amazing thing about it, which should make us believe more in God, is that when they are all inside the vagina, they only go in one direction. They don't go in the other direction. How do they know the direction where the ova is? This is some miracle. We don't know anything about it until today. And once they enter right here, most of them know the direction that the egg is in that side, not in that side. 90% will go to that side, 10% of the stupid ones, they go to this side, and then they realize they will jump anyway, so they die. The one who reaches that side, the chromosome has a special structure on him. He has a hat on his head like this, and that hat has underneath it vitamin C. Vitamin C is acid. Acid dissolves tissue. When he comes to her right here, there are maybe approximately 100 million will make it to that area. The first one will come right here, and then he raises his head and he says hello, and then he dissolves the membrane, he puts the head inside, leaves the tail moving for about 72 hours to tell the other sperm, I beat you, don't come inside. So once they see the tail moving, they say, okay, it's all over for us. And then a child is born. Right here is the egg that has been fertilized. That egg will multiply to 4, to 6, to 8, 16, and then, as you know, the numbers grow, and they come inside the uterus right here, and we have 64 cells. The 64 cells they need food. The best way to get food smartly is they grow roots like that, and each root has in the end of it a little bit of vitamin C. Those vitamin C dissolve in the membrane of the mother, and she will have a drop of blood or 2 drops of blood in the ovulation time when the fertilization occurs, and that's the first signal that the egg has been implanted. The egg implanted, and we call this area here the placenta, and the placenta, I'm going fast because this is not the main topic we are talking about, just to make it interesting so you wake up. And then the placenta accumulates and gathers lots of vitamin E and lots of vitamin C and lots of vitamin D in that location because they are antioxidants. When the mother drinks her alcohol or takes her chemicals or takes her drugs, if that happens, then these get filtered right here so the baby does not get drunk and get deformed inside the mother before he comes out. Most of the time, these vitamins detoxify. So if we're dealing with a mother, of course, who does not take nutrition and take drugs, we can expect a very damaged children when they're born out of her. The baby grows, and in a period of no less than, by the time you know you are pregnant already, that baby already has been implanted inside, and he already has the head, and he has the body, and he has the legs, and he has the arms start budding out. They come budding from inside out. That's how they occur. And the heart starts beating using the mother's blood. It doesn't use its own blood. So the blood goes in, it goes through the baby heart, it goes around. He doesn't have his own blood, so he uses the mother's blood during that period of time. And it starts to grow. And uses everything from the mother. Uses the protein, the vitamins, the minerals, everything he needs to take it from the mother. And this baby then grew to a size right here. Oh, I don't know what's going on. Okay. It grew to a size, and then normal size, and then the delivery occurs. And here is a child ready to come out, the head is down like this, and the body right there, and the legs right here, next to him, and the placenta right here, and the hands right here, sucking his thumb, whatever he's doing. And then he comes out. Once that comes out, he immediately starts getting some food from outside and starts to grow. If we analyze that child inside us just to come out, we will see that he has certain structure in him. Inside here, the head, there is a mother gland called the pituitary gland. And that gland starts working right away. Before the child was born, the gland was not working very well, was shut. Once he's born, that gland starts working. And there is another gland in the neck right here called the thyroid gland. Another gland in the neck here called the parathyroid gland. Another gland right here in the intestine called the pancreas gland. And then there is a gland above the kidney here called the blood, the adrenal gland. And there are two glands right here and two here, not in the same person, those called the ovaries and those called the testicles. This is how the glands of the human body. And they start working. How do the glands work? What are the functions of those glands? If you study a human body, you will see inside it there are several organs. And each organ is controlled by the glands. Here is a picture of a skeleton which is made from bone. That is one organ. And that organ made from what? From bone. It does have function. That bone makes blood, supports the body, and defends the body against infection, all of that. That bone is controlled by glands. Which gland controls the skeleton? Every single gland, especially the parathyroid gland. We cover this person with skin. Turned out to be your skin is jaundice today. And that skin also made of cells, and it has functions also controlled by glands. So the skin texture, the aging of the skin, the circulation of the skin, the wrinkles in the face, all of those controlled by glands. Glands or hormones are the cause of aging of the skin. And when we have a problem with it, they cause this problem. And when the skin is cold, that's also from glands, from hormones. So everything is hormonal related. So you can't, if your glands are not working right, regardless of what you take, proteins, carbohydrates, or fat, or anything you take, if the hormones are not working, then the food goes in and out. Inside this body, there are several organs. One organ here some people don't have. We can say that every time, and we can see more people each time. Okay, this gland, this organ here, the brain, also controlled by glands, by hormones, and we're going to be talking about each of those organs during the evening. Inside here, we have a heart that circulates the blood, also controlled by hormones. We have the lung and the breathing, also controlled by the pituitary gland. We have a digestive system, we have a stomach, and an intestine, controlled also by the gland. We have an ovary that does detoxify, and a kidney that is detoxifying, also controlled by the hormones. So to control this body, we also have other organs that I forgot to put, the muscles of the body. The muscles in the legs right here. The muscles in the arm right here. Without having lots of muscles, we become flaccid. We become like multiple sclerotic patients, ALS patients. Myasthenia gravis. We can't function very well, and we have what we call muscle atrophy, and those also controlled by glands. So, how does the glands work? The mother gland is in the brain right here. The mother gland secretes certain hormones. glands. We have the mother gland and the baby gland. The mother gland is called the pituitary gland. The other glands, the baby glands, that control specific functions are in the neck. We have the thyroid. We talked about a few minutes ago. In the back of it, we have the parathyroid right here, and that parathyroid gland. And then down here in the intestine, we have a gland that helps digestion and secretes insulin called the what? We have the pancreas, that's a gland. Above the kidney here, we have a gland called the what? Again, adrenal gland, and we have the ovaries and the testicles are the glands right here. So if we want to understand what goes wrong with the hormone, then one has to understand there's more than just one hormone. And I'm going to tell you this. There is no single hormone in the body can be abnormal without the other being abnormal. There is no single hormone abnormal unless the other is abnormal. Every hormone depends on the other hormone. Do you understand? Okay. How big are those glands? The pituitary gland, how big is it? It's no bigger than the size of a large bee. And in the meantime, that gland secretes 7 hormones. Actually, I'm sorry, I take that back. It does not secrete all the hormones, 7 hormones, all hormones, secretes stimulating hormones. So it does send a wire right here to the thyroid to tell the thyroid to work. What does the thyroid gland do? What is the thyroid gland going to do to that baby just being born? What does it do? If the thyroid gland is working right, it secretes thyroid hormone. What does the thyroid hormone do? It makes the baby think, make him see, make him hear, make the heart work faster, make the intestine work faster so he can absorb, make the skin warm so he doesn't get cold, and he makes him alert. So that applies to you right now. What I said about the baby applies to us. So when the thyroid is low, then the brain will be foggy, the thoughts are not there, the muscles are weak, there is no energy, the heart is slow and skippy, and the person will gain weight easy, eat any kind of food, and you can burn it, so it converts to fat. And then the vision is everything is disturbed, and that's the thyroid gland. If the thyroid gland is overactive, then the person will have lots of problems. The eyes start bulging out, like President Bush's wife. We have exophthalmos, we have those problems, and we have many, but we don't see much of those anymore. We see a lot more in women, low glands, not high glands. We haven't seen many women with high glands in this day and age. Most of them, 99% of the patients we see, they have low glands. Their glands are shutting. Everyone is shutting. And we have difficulty with success. Lots of success I had the last 15 years, treated over 15,000 women, and some men also, that we have successfully stimulated the thyroid and the adrenal and the ovary and all of that to work if they're still alive. The parathyroid gland behind this right here. The parathyroid gland, what does it do? It gives a message from the mother gland. What does it do? The parathyroid gland, when it gets the message, it tells the intestine do something. Let us take a trip right now and visit with the parathyroid gland and see how does it do its work, because that gland is very important in many diseases. Very important in anemia, it's very important in energy, it's very important in osteoporosis, in osteoarthritis, in all those diseases. So let us take a look at this gland a closer, because that is one gland that's being ignored in our medical society. The parathyroid gland is in the neck. It's a little gland right here in the neck, which each gland have a little guy like this with 2 hands and 2 feet, like that, and those are the parathyroid hormones. What do? They put their hand inside right here, and when the blood is moving, this is blood, moving, going to the brain, they check and they analyze the blood to see how much calcium and how much magnesium and how much manganese and zinc swimming in the blood. Are you following? If they detect that the calcium or magnesium, manganese is low, they immediately send alarms all over the body to tell the body we need more calcium, more magnesium, more manganese. Because if the calcium in the blood goes down from the normal calcium between 8 to 10 milligrams per 100 ml, if the calcium goes down from 8 milligrams to 7.5 milligrams, that's a decrease of 0.5 milligrams. Are you following me or not? Just a small decrease between 8 to 7.5, you will have cramps in your leg that you cannot stand. And anytime you have cramps in the leg that you couldn't think about, calcium is the first mineral have gone down. You understand? So when the muscle cramps like this, because the calcium went down from 8 to 7.5, and the heart is a muscle, what do you think is going to happen to the heart when it has a cramp? The heart will ache, and you will have angina, and you will have some kind of fatigue and tiredness, and you go to sleep until the spasms go away. If the calcium goes down from 7.5 to 7, your heart will be in big trouble. But also the brain will shut down completely. If it goes down to 6.5, the heart will stop. So here we have very critical situation that the decrease of minerals by a little bit can cause disaster in the human body. You follow me or not? This is why the Lord put those glands to guard against accidents. You know, that because in those days when Adam came to the earth and he was running around with Eve, you know, and suppose he could not find the calcium for 2 days. What's going to happen to him? He's going to die and we're not going to be here? You can't do that. We have to be here. So what happens? The calcium has to come from someplace else. So he was created with lots of calcium in his what? In his bones, which from the clay he was created from. Believe me, that's a true story. You know, some people think that Adam came from monkeys. We don't look like monkeys. Some of us might do, but actually it's not like in any way, if inside the body there is an intestine, stomach and intestine, inside the body we have a kidney, and inside the body right here we have bone, a piece of bone like that. When the calcium gets down, let us suppose we are sitting in the lecture right now. You have dinner, and you have food which has calcium in it, or you have some calcium supplements. So there is calcium and magnesium in the intestine, right? The normal procedure, when you are sitting right here, and your brain requires lots of calcium because you are thinking about the lecture unless you are asleep, or there is no brain, which I didn't. Then you immediately start feeling that the calcium is going down. to 8 again right away. Very simple. The calcium is a mineral in the intestine. The calcium cannot enter the blood without help. Because minerals that are dangerous to the body will not enter unless the body tells it to do so. Are you following me or not? Because this is a very critical question some of you might ask me in the end. What happens if I take extra calcium? What happens if you take extra calcium? Nothing will happen. Because calcium do not enter the blood unless the body wants that calcium to enter the body. And you follow me or not? So if you have kidney stones or you want to live, it doesn't really matter how much calcium you're going to take. It's going to go out. If you have a kidney stone, because you absorb so much calcium, because you have hyperparathyroidism, that's a disease by itself, it has to be treated, but you cannot stop eating calcium. Then, the calcium to enter the blood, how does it do that? There is something we ate with the calcium called alfalfa, or salad, or fiber. Alfalfa is the best. It has a vitamin called vitamin what? Vitamin D. Vitamin D will sit right here in the intestine and he refuses to move. He becomes the doormat in the intestine. He opens the opening and he sits there. That's what vitamin D does. His job is to get the message from this gland. When this gland is detected that the calcium and magnesium are low, they have a telephone and they call this guy, tell him the calcium is down to 7.5. We need a half a milligram of calcium. This vitamin D says, okay, is a half a milligram of calcium in. And the calcium goes in and you don't feel anything. Now, if there is no calcium here, or no vitamin D here, what's going to happen? What's going to happen that this guy here will send a message to the bone. To tell the bone, I heard you have lots of calcium in you. The bone said, yes, I got plenty. I said, give us some. And some couple pieces of calcium will come out, leaving a hole behind it. You understand? And this day, if you get the calcium and the vitamin D, the hole will be filled. But if you don't, and you have calcium deficiency, and you don't do that, the many holes will develop in the bone, and the calcium level stays about what? Always around what? Around 8. But the bone will stop. And some of the calcium will be pulled out of other tissue, but the bone is the first organ to suffer. Then we have a new disease developed in the body. Not only we have calcium deficiency, we have a bone fragility. Because the bone has many pores, and the word bone is osteo, we call the disease osteoporosis. And the osteoporosis will develop. It takes approximately 10-20 years to develop osteoporosis. So don't expect you're going to develop it overnight. And then one day, when you have osteoporosis, you're walking around, and here we have, this is you right here, and you have osteoporosis, and you walk suddenly, or you slip suddenly, and fall suddenly, and where are the stress points in the human body? Which one? Number one is the hip. Number two, the knee. Number three, the ankle. Number four, the low back. The stress. Stress means the point that gets the most weight and the most. So all of a sudden, you hit something snap, and a bone is broken. And you don't even know it sometimes. Sometimes you didn't even know the hip is broken. And then you just have pain and pain. As a matter of fact, I have a friend of mine, I met him 23 years ago when I came from Egypt, and he's still my friend until today, him and his wife. And he's 75 years old. Every time we go to hotel, we take a walk, me and him. We were walking in the mountains uphill, and he came down, he had pain in the head. We didn't know, he went to his doctor, he treated him for a whole year, and the thing is getting worse and worse. I told him, there's something wrong in your head, you have to open up and have an operation. They opened, the head was broken, and the x-ray missed it. And he suffered all that time. And he had osteoporosis. His other hip had osteoporosis. Every place has osteoporosis, and we had to do something to build the bone back. How would we do that? We have to give him more what? More calcium and alpha. Exactly. Stay with the topic. Don't go to the protein yet. Just stay with the topic right now. Okay. The protein is important. It's not important right now. So, he needs more alfalfa, more calcium to take. However, we found something. When the calcium enters the bone, enters the bloodstream, the calcium cannot enter the bone without a hormone called estrogen in women and testosterone in men. So, if that person does not have enough estrogen as a woman, or does not have enough testosterone as a man, all the calcium going in will not enter the bone. So, we had to analyze the blood. We find out that his testosterone is very low. Then we gave him extra testosterone, and the calcium filled in, and the other head was fine within a year. And he didn't need any more surgery or any problem. So, this is the story right here about the parathyroid gland, how does it work. But having calcium deficiency and vitamin D deficiency from alfalfa, that will lead to other disease. And then I told you before when I started the lecture, when we put this topic here, PMS, impotency, osteoporosis, hypoglycemia, diabetes, everything relates to nutrition. We're not here to discuss how much insulin you should take and how much it is. We have to discuss the role of nutrition in these diseases. You follow me? So that's what we're doing right now. Because if we stick with nutrition, healing is much better and health is much, much better. We can add a little bit estrogen or testosterone if the person needs it. The bone that got weaker is that person who have low calcium, low vitamin D, low testosterone, low estrogen, that bone right here also supposed to be making other things. What does the bone make besides support to the body? What does it do? It makes blood. That's right. The blood, there are several cells. The red one, we call it red blood. And the white one, we call it white blood. So there is the red blood and white blood. You didn't know that we have red blood and white blood. The red blood cells, they carry oxygen, they travel inside the body, they take oxygen from the lungs, and they give it to every tissue. So if you don't have enough red blood cells, we have a disease called what? Anemia. And the symptoms of what? What are the symptoms of lack of oxygen? Lack of oxygen to the brain, you sleep a lot. You cannot think. Every time you sit, you fall asleep. That's a sign of anemia. Fatigue, tiredness. The heart is a worker right. Cold. All this sign of lack of oxygen. Correct? So that is, in a person who's developing osteoporosis, is not producing as many red blood cells as they should, then they would have anemia, and we have fatigue and tiredness. And when that person goes to a doctor with the fatigue and the tiredness, and the doctor says, okay, we find anemia, what does the doctor give usually for that anemia? iron and vitamin D. But does this person need iron and vitamin D or need something else? Or it needs a person calcium and alpha. I'm here to show you that you can't treat the disease, you have to treat the cause of the disease. You cannot treat only symptoms. You got to know what's causing that symptom, otherwise you're just spinning your wheels and getting nowhere. This person who has anemia that's not responding to iron, not responding to vitamin D, can really respond to alpha and calcium and magnesium then. Then there is another cell coming out called the white blood. The white blood, we call it white blood cells. What do? They fight what? Cancer. They fight infection. And they fight poison, allergies, and pollen, and stuff like that. So having low white count, then there is more allergy, there is more infection, and maybe more cancer. So if we have somebody having all this problem, what I do usually when I see that, I take an X-ray of the bone, I do this, and all the tests all done at one time. And after we establish there is osteoporosis, there is anemia, there is cancer, we start to treat it from the root. Give the person better alfalfa, more calcium, more better hormones, they start building themselves from within, and then in 6 months or a year, they much better. And this was the function of the parathyroid gland and the disease related to it. We have other glands in the body, also have other functions. The gland right here, the fifth right here called what? The pancreas. What is the function of the pancreas? To understand the function of the pancreas, let us look at the person. You have a digestive system, you eat starches, or eat sugar, or eat fruit. It goes inside the intestine. Inside the intestine here, there is a little chair with a guy sitting on it right here, with 2 hands, and holding a binocular in his hand like this, and he's looking to everything you eat. The name of that person is Mr. Gastrin. I forgot to tell you that. That's a mistake on my hand. That the stomach makes a hormone too called gastrin. I almost forgot. Mr. Gastrin hormone, he sits in a chair with his binocular like this, looking up, and he saw sugar coming. Or he sees starches coming. That means what? Means lots of starches and lots of sugar, means we're going to have lots of sugar in the intestine. Means the gut is going to be sweet. Too sweet. And if that's too sweet like honey, then all of this will go inside and the blood will be what? Sweet. And that's no good. Because the sugar in the blood should be between 70 to 115. If it goes below 70, we have a disease called what? Low blood sugar, hypoglycemia. Sugar is the food for the brain, is the food for the heart, is the food for the muscles. When you have a low blood sugar, means you cannot think clearly, you cannot see well, you cannot hear well, you're going to be too tired, and you're going to sweat, you're going to be hungry, because sugar is energy for the body. And you grab a fruit right away to eat it, or something sweet, because it feels good to do that. That's when it is low. When the sugar is high, what symptoms do we have? The sugar keeps rising from 115 up to 180, and you have no symptoms at all. So you can have sugar right now of 179, and you have no symptoms. What happens for the sugar between 115 to 180? The extra 65 milligrams of sugar, what happens to it? I go back. You only need 115 blood sugar to live. If you have 180, what happens to the extra sugar? sugar, some of it will be stored to fat, but not much, about 10. And some of it stored to glycogen, about 5. About the 50 extra, what happened to it? The 50 extra will go to the kidney and come out. The kidney senses extra sugar in the body. How that happens? Again, we'll go to the neck. There is a gland right here in the neck, carotid body, like a parathyroid here. This is up here high. In this location, they have long, not long arms, long tongues. They taste the blood. And when they see the blood too sweet, they send a message to the brain. They say, the blood is sweet. The blood, the word is sweet in Latin is militus. Militus means what? Means honey. In Latin. Means tastes like honey. The blood is tastes like honey. And then the kidney opens and gets it out. If the kidney is not working right, or the sugar keep rising up, the extra sugar converts to alcohol. And every cell in the body gets drunk. And the alcohol will poison the nerves of the arteries, the nerves of the heart, and the nerves of the brain, and the nerves of the legs and the eye, and the diabetic patient will start having vision problems, leg problems, sensation problems. You know, diabetic can sit on a hot place and they don't even know it's hot because the nerves are drunk from the extra sugar, the extra alcohol. To avoid this problem, there are cells right here called the beta cell that secrete insulin. They get a message from this guy, tell him, we expected this person eating lots of fruit, eating lots of sugar. It's not good for him, but he's doing it. We need you to make lots of what? Insulin. And you keep eating sugar all your life until the pancreas becomes a what? Empty of what? Of insulin. Then you eat sugar, and the sugar goes up in the blood, and you have a problem, and then you have to take insulin from outside. This gland right here, function is to maintain the sugar blood level. When it gets exhausted, that gland requires minerals like zinc, magnesium, manganese, and chromium, which come from Formula 1. They actually have. Excellent product, one of the best products, is the best product they make. This will help to restore that pancreas back if a person is diabetic. But if the pancreas is dead already, then the insulin has to come from outside. We covered right here the two diseases, the hypoglycemia and diabetes and the pancreas. And let us move down to the adrenal gland. I added that. This was not part of the lecture. We're going to talk a little bit here about adrenal gland also. How does it work? Why? Because if the adrenal gland is not working, you're not making adrenaline. When you're not making adrenaline, what happens? You need it, right? When your adrenaline is good, you feel it or not? When your adrenaline is not good, you feel it. So you can imagine, what's adrenaline then? Adrenaline is a hormone, comes out of the adrenal gland, which maintains the blood pressure. Keep the blood pressure normal. Not too low, not too high. If the blood pressure is too high, the adrenal gland sends a message to the kidney to tell the kidney secrete the salt. If the blood pressure is too low, it sends a message to the kidney to tell the kidney keep the salt. Because the salt makes the blood pressure go up and down. So that's how the adrenal gland works. Let me go back to something important here. Adrenal gland makes a lot male hormone and make cholesterol. Your adrenal gland makes the cholesterol. It makes only the good cholesterol. Only makes the LDL, the HDL, not the LDL. So when you measure your cholesterol in the blood, and your cholesterol is 250 and it's high, if the majority of it is the HDL good cholesterol, don't worry about it. However, if your cholesterol is 150 and the majority of it is the bad cholesterol, the LDL, worry about it. So measuring blood cholesterol is a useless test. You follow me or not? You got to measure the LDL, HDL ratio. You got to. HDL is improved, gets up right there when you take Formula 1, when you take beta-carotene, when you take EPA, when you take fish oil, when you take regular vegetable oil and eat vegetables. And LDL goes up when you have a problem in the liver or you eat so much saturated fat and so on. So it is not hard to control that unless you have a liver disease. I have a patient who started with his LDL triglycerides for 12,000. 12,000. And he is born that way. His brother died when he was 6. His father died when he was 40. His mother died when she was 40. All his brothers and sisters died when they're 40. So it's a hereditary disease, right? And I don't believe in hereditary diseases. I happen to believe that hereditary exists, but if you do your best to control it, you can live as long as God wants you to live. It doesn't matter if your mother has cancer, you still can live without cancer. You follow me? Hereditary is an easy thing for us doctors to say, okay, your brother died, your father died, you're going to die. Goodbye, pay your bill, and go. That is not what we did. What I did with David was young, he's young. I said, well, he is. Maybe he will see that day. And he worked for, in Iowa, in the tire company, makes tires, and they sold, I think, Firestone or something. They sold it to Pirelli or something like that. Anyway, he worked about 2 shifts, and he tried very hard to get his cholesterol down. And when we brought him on this diet, we were talking about the cholesterol down to 1,700 from 12,000. But we can't get it down below 1,700, then we have to use drugs. We lowered it to 600, and that's it. We know now that's the best we can do, and we know the artery is going to give him blood. We give him chelation, open the artery, and he's still doing fine for the last 10 years. He's been going, the heart is still doing good, the brain's still doing good, the kidney is doing good, the blood pressure is good. Just recently he started developing diabetes, and that's also going to be good. We're going to control that also. So adrenal gland makes cholesterol, makes cortisol, makes all of these type of female hormones and male hormones. When this gland is the gland of the stress gland. So when you're under stress, your adrenal gland come and help. Nobody under stress, adrenal gland doesn't kick in right away. You need it anytime. I can take you 5 o'clock in the morning, 4 o'clock in the morning, when your adrenal gland is shut completely because you're asleep, and then you hear a fire in the house, and in no matter than 10 seconds, adrenal gland is going full blast, and your blood pressure is up, everything, and you're going out of the door. That's the miracle of the human survival. You follow me? You're not going to be waking like this and say, oh, it's a fire, let me take another nap. No. You know exactly what you're going to do. Why? Or you hear a phone. Your mother fell down, or your son got hit by a car, or there's a list immediately. You're awake, you alert, you're conscious, you know where you're going. And us doctors, how many hours do we get sleep in 15 years of training? 4 years of medical school, 3 years of training, 5 years. We get maybe 3, 4 hours, 5 hours a day. But you get 1 hour sleep alert. And some of you have been in the emergency room and seen that. So adrenal gland is response to stress. Because we have so much stress in life these days, stress is so much more than ever in our life. Stress in health, stress in the job, stress with the kids, stress in TV. Even when you want to relax at night, try to relax. In the old days, at least the farmer used to relax, take a walk by the river, smell the flowers, watch the trees, watch the beauty of nature. No, we still watch TV these days, and the first thing, how many people get killed? Tornado hit there. So who cares how many people get killed in the Gulf if we're going to have a stress and we can't do nothing about it? But the problem is the news keep us on edge all the time. And then the telephone rang, more stress. And then the wife will yell, or the husband yells, or the kids scream, and the stress can go on. We have what we call adrenal insufficiency. Adrenal insufficiency starts to develop. When I was in medical school, I asked my professor of endocrinology, having so much stress, how come we don't teach adrenal insufficiency? What's adrenal insufficiency? Means weak adrenal gland. He said because it doesn't exist. Adrenal is perfect 100% forever. I said, well, I don't believe that. The book says that. Adrenal never gets sick. And then we find out nowadays that the adrenal gland gets low in adrenaline. Then you wake up tired. In the evening you're very tired. And you don't have energy. You have chronic fatigue syndrome, and you might think it is from virus infection, which is problem could be adrenal insufficiency. You might think it's a hypoglycemia, when actually it's not a hypoglycemia. Then, when you stand up, you get dizzy because the blood pressure is not good. When you stand up suddenly, you get dizzy because the adrenal gland is not working right. And you don't have enough cortisol in the adrenal gland. You cannot fight allergy. What's the cortisol for? What does cortisol in the gland adrenal made for? You know steroids. What do the steroids do? They fight allergy. They fight allergic reactions, right? And your body, when it makes enough cortisol, will fight allergy on your own. And all allergy we develop, most of it is because there is adrenal problem. Adrenal insufficiency can lead to adrenal crisis, Addison disease, and the patient can die. You hear about people tell their family, I feel I'm going to die. Have you heard of that? There is no magic in this thing. There is nobody raising their hands and telling them I can see the future. Patients, people know themselves very well. My professor was 80 years old one time in medicine in Highland Park Hospital. He said, if a patient tells you something is wrong, believe it. That is something is wrong. Because the body tells you something is wrong. When the adrenal gland gets low like this, you keep trying, sleep more, do this, do that, until you reach the stage, you go to somebody in nursing home, they tell you, I feel I'm going to die. Or they refuse to eat. Have you seen that in your life? And they die. They die because the adrenal gland shut. In my practice, when I used to go to a nursing home and see somebody in that situation, I know they're heading towards the grave. But when I analyze their body, I feel their body is still strong. So what we do, we give them cortisone from outside. Steroids, IV, 100 milligrams or 2,000 milligrams. Next day we ask the person, how do you feel? I feel fantastic. You're going to die after that? No, I never said that. So actually, the human body has the ability to heal, but when it gets to the stage of exhaustion, sometimes it gives up. Let us go and talk now about the problem of men and women both, the ovaries and the testicles, called hormonal imbalance, which estrogen deficiency and also impotency. Okay. and men both. In the ovary, right here, a woman makes estrogen hormone for approximately 16 days. And she makes, or let me change it out to 20 days, easy to calculate, and makes progesterone hormone for 10 days. Why does a woman make two hormones, estrogen and progesterone? What's the reason behind that? Anybody know? Anybody knows why there is estrogen progesterone in a woman? Man doesn't have that. For a good reason. Because when we go back to the behavior right here, to produce the egg, we need progesterone. You need the progesterone to make an egg. To get rid of the egg out of the body, it's not fertilized, wash it out, you need estrogen. Well, that's easy. So actually, estrogen and progesterone control what we call the period, menstruation. That's easy for every woman to understand. There is a lot more to it than that. We find out that estrogen, which comes in a girl at the age of 10 years of age, and she has absolutely no idea about estrogen or progesterone, all of a sudden that innocent girl starts having enlarged breasts, starts looking different from her brother, and she starts acting different from her brother. And her brother starts acting different from her because the hormone estrogen does certain things to a woman, hormone progesterone different from a man. Estrogen, what does it do? Number one, in women, it does cause the menstruation. That's the estrogen now. And the progesterone both. Well, let me take each one at a time. Let's take estrogen here and progesterone right here. Estrogen, it causes the bleeding to stop. Progesterone causes the bleeding to stop. You understand that? So if you're bleeding too much, you have too much of what? Progesterone. And you need more estrogen. If you're not bleeding at all, you might need more progesterone. So we have to understand that's one bunch. Number two, progesterone causes ovulation. They're responsible for pregnancy. If that's going to be the case, which it is, this means the woman better be prepared to have a child. To be prepared to have a child, you have to be in the best condition psychologically and physically. So, you notice a person or a woman who is depressed, when she gets pregnant, she becomes happier. You don't see many depressed pregnant women, unless there's something wrong out here. Because naturally, the progesterone hormone is a happiness hormone. It makes you cheerful, makes you happy. So, you are happy with it, and this is why the lack of progesterone causes PMS, premenstrual stress syndrome. So we cannot keep replacing hormones with hormones. Remember that. If there is a PMS and we give progesterone, we might give too much. We hurt the person. We might give too little. It's not enough. It's always good to find the cause of the problem rather than just give something right away. You understand? About 15 years ago when I started treating PMS, I used to treat PMS purely with progesterone hormone. Later on, I discovered I didn't have to do that. We correct the adrenal, correct the pituitary, correct the thyroid, correct all the glands. Maybe the ovary would be correct. It was. It's corrected, and the people doing much better without taking progesterone. Estrogen hormone, besides it does make the bleeding and stuff, it is a birth control pill. Birth control pills are estrogen also. Progesterone prevents cancer of the uterus and and the cervix. Natural estrogen can cause cancer of the uterus. So why God gonna create somebody with a hormone that causes cancer? Because he creates the other hormone that prevents cancer. Are you following me or not? This is why you hear about estrogen cause cancer. Estrogen doesn't cause cancer in a person who have a uterus who have taken progesterone. But if you don't have a uterus, then you can take the estrogen alone. But if you take that alone, estrogen, yes, the chances you could develop a problem. When I discovered that, this is by discovering what's coming now. I discovered that estrogen keeps the skin soft. And when women have lack of estrogen, the skin will wrinkle a lot faster, age a lot faster than if she has enough estrogen. And keeping the skin soft by putting collagen in it, collagen is a substance that keeps the skin nice, also does the same thing to the arteries. So it prevents LDL from sticking to the arteries. And you don't see many women before the age of 50 who have clogged arteries. But you see lots of men below the age of 50 have clogged arteries. And the reason, for some reason, estrogen prevents arteriosclerosis. Estrogen prevents heart attack. And estrogen also keeps the brain functioning good. And when a woman then starts developing lack of estrogen, not only she develops osteoporosis, remember when we talked about osteoporosis, but also she can have a problem with premature aging of the skin, high blood pressure, and then every place goes down. The brain doesn't function well, hiatal hernia, weight gain is secondary to lack of estrogen. It is not estrogen causes water retention, 3 pounds or 4 pounds, all your life, that's it. The maximum is 3-4 pounds. But estrogen prevents fat itself from development inside the body. You understand that or not? So it is, when you gain a little bit weight or the breast gets enlarged when you take estrogen, it's supposed to do that. It's supposed to get the breast enlarged. That's its job. That's job is to rejuvenate the breast. So rather it's dying, it's getting normal. And that's what estrogen does. The brain function to improve with it. Plus osteoporosis. So when we talk about estrogen, we talk about a hormone that does many things. One of the most common things with this we see in that hormone is the sexual desire in a woman is caused from the estrogen. And the progesterone causes the inhibition of the sexual desire. So progesterone will inhibit the sexual desire because that is the preparation for pregnancy. Yeah, just think how the cycle of life always continues. It's just like animals. When a female is not ready, she will not accept the male because she's producing progesterone, ready to have a child. And in human beings, we go around it because the man says, well, I married you, I bought you, you got to lay down, you got to, that is artificial stress cause. But in nature itself, if everything goes back to nature, there is no sexual desire, actual sexual desire in the period that progesterone is produced, which is from the first days of the period to approximately to the 10th day of the period. From the 10th to the 15th, when the ova will come out, yes, estrogen will come, and there is intense desire then, because that's a fertilization stage. And then when it gets to the 25th day, progesterone comes back, and then it inhibits again. So there is a cycle every month in all creatures, include men. This desire, it gets decreased in women when they have low estrogen, and it can be corrected with the estrogen correction. Estrogen keeps the skin of the body from aging, but also remember that the inside your eye, lacrimal gland, is some kind of a skin. So when you don't have enough estrogen, your eye will get dry, your mouth will get dry, the vagina gets dry, the intestine gets dry, everything gets dry. And when the estrogen replaces, everything goes back to normal. All this is reversible. Everything we talk about. But when you replace estrogen, it has to be exact. The dose has to be accurate. Nowadays, we use natural estrogen, and we measure the amount in the blood and see how much a woman is supposed to have approximately between 150 to 300 level. We try to keep it in that range. Progesterone, about 3. We try to keep it in that range, but we don't get it. We take a blood test once a year or every 6 months in the beginning until we correct it, and we go once a year after that. Now, we talked about this problem in women. Let us talk about the other problem in men. The other problem in men is called impotency. To understand for men impotency, this is a problem ignored for years. Ignored by men and by the doctor. And also PMS was ignored by the doctor, but the patient always asked for help, but the doctor said there was no such thing called PMS. But right now, I have found out that when a man goes through changes in life at the age of 40, and his testosterone level might come down, other problems develop. One of the problems develop called impotence. It gets, at the age of 50, goes down more, at the age of 60, goes down more, at the age of 70, goes down more. But is this problem permanent or is it not? The testicles make testosterone hormone. Testosterone hormone keeps the blood pressure up. When the blood pressure stays around 140 over 80, or 120 over 80 in man, normal blood pressure in women is 110 over 60. In men, it requires more blood pressure because they have more muscle. It needs more pressure to push it in the muscle. But one of the muscles that he requires that also is the penis muscle. The penis muscle, which is flaccid, gets full of blood, and the pressure goes from 0 to 180. Mercury pressure from 0 to 180 by the stimulation of the brain during sex. Lack of testosterone will create problems in reaching that goal. When that goal is not reached, the valve doesn't close, and there is a plasticity in the penis. So the first problem, it has to be corrected in patients with impotency, is testosterone deficiency. Some people say psychological. It is some of it everything has psychological factor in life. But organic factors are more important than psychological factors. Some people have lack of circulation inside here. Those ones with coronary artery disease, with high cholesterol, we can correct that too. And the most recent study we have done implants on people. We have used the vacuum system, the vacuum pump that engorges the penis on rubber band put here, and we have patients at the age of 80s and 90s using it, and there is no problem. It's not perfect, but better than nothing. Because sexual stimulation is something involuntary. It's not voluntary. You remember that. Sexual stimulation, is not voluntary. It's involuntary. You know what the difference is voluntary and involuntary? You are born, you have to eat, if you don't, you die. You have to sleep, if you don't, you die. You have to have intercourse, because if you don't die, but eventually you might die. Somebody might kill you. But anyway, this problem right here is being ignored, and it has to be addressed between the patient and the doctor without the wife knowing, without anybody knowing. Can be discussed in confidence between you saying, doctor, we take care of that, we refer the patient to urologist, and whatever. And once we corrected this problem in men, and this other problem in women, the quality of life itself improves in people, and they absorb better, they exercise better, they enjoy their life better. This is it for the lecture for you tonight. I'm going to leave my number in my office for you, 708-356-9009. Okay. I will take some questions from this side and this side for the next 15-20 minutes because it is important. If you have a personal question, you can call me, leave your number, I will get back to you, we can discuss it by phone. If something I can do over the phone, I will do it. If not, I will insist that you have to go to a doctor to get a check or come over to my office and I will do it. Insurance companies cover blood tests for hormones, most of them do. Some of them don't, and that depends on the person's power. I'm going to take questions from this side and this side after that. Yes, ma'am.
What can you do to nurture your adrenal glands prior to, having difficulty?
The question is, what can you do to improve the adrenal gland? Adrenal gland depends on the stress. First of all, adrenal gland, you have to take care of the stress factor in the body has. Maybe infection, maybe mineral deficiency, maybe pituitary exhaustion. Pituitary gland secretes a hormone called ACTH, adrenal corticosteroid hormone. ACTH is a natural hormone coming from the pituitary gland. Kill the body, the adrenal works. Maybe the adrenal gland making too much ACTH. So we have to study to see what causes the adrenal gland problem. But rest and taking care of the stress, exercise is one of them. Meditation another, sleep is another, vacation, and getting rid of the stressful factor is very, very important. Yes. Yes, sir.
If you have a vasectomy, does that stop the testosterone production?
Vasectomy does not stop the testosterone. Testosterone does not come in the sperm. They come in the bloodstream. Testosterone has to go from the testicle in the blood to the brain. And the brain has to secrete FSH and LH hormone, which in return has to come to the muscle of the fetus and contraction. It has to go through the brain first. So it does not affect. Yes.
Could you tell me what Hashimoto's disease of the thyroid is?
Well, Hashimoto is a Japanese guy. And that's an autoimmune disease when the thyroid gets antibodies to attack it and destroys it. And that's a topic we talk about in the future. Next time when we come, we're going to be talking about autoimmune disease when we will talk about it. Yes.
Side effects of being on steroids for a long period of time.
Side effects of steroids, yeah. If you are in a steroid for a long time, when you take steroids from outside, your adrenal shut down. Because adrenal reads how much steroids going out. If you take it from outside, you shut your own adrenal gland. So that is a danger. Yes.
Is there any way you can get estrogen other than orally or through medicine? I cannot take it because I get a stroke and I do need it.
Oh, no. There is no relation. I have patients with stroke who give estrogen. There is a misconception that if you have a stroke, you have more clots. If you take estrogen, you have more clots, and that's not true at all. That's not true. That study like that you're talking about, the doctor who did that study was wrong because if a person has a stroke, we give him a better diet. We give him enough vitamin E. We give him an aspirin. We give him estrogen and progesterone, and they have no change whatsoever in the PT and PCT blood clotting time. Absolutely not. But you see, the fear of something can lead to disaster. For example, I had patients say, 15 years ago, I had women say, I'm not going to take estrogen because I have a fear of cancer. The other said, I have a fear of blood clot. The third said, I had a stroke and I don't want to have another stroke. Well, they didn't take it. 15 years later now, the one who did not take it had a heart attack, has more to know, your doctor must be old-fashioned because there is right now enough papers. 15 years ago, when I started saying these things, take estrogen, I was under attack by people in the nutrition field because here I am, nutritionist, against the drugs, telling women to take estrogen. And they said, how can you say that? That causes cancer and all of that. But I did say what I thought is right. Now, my theory about estrogen is being accepted all over the world. Every doctor, most of doctors believe in it, and now we know without estrogen you are finished. Finished, gone. Estrogen is something you got to have if you have a quality of life. But if you have other problems, we can control. We can give maybe one aspirin, maybe 800 grams of vitamin E, maybe we keep the blood thin enough that there's no clotting. But I cannot tell you the truth. Out of over 12,000 women I recommended estrogen, not single one had a blood clot. Not single one had cancer. So we got to talk about actual statistics we have. You got the number right here, you call the office, and I'd be glad to help you. Anybody in this section, I cannot see beyond the line. Okay. No, this section right there. Okay, yes.
What do you take for a lot of stress, when you're under a lot of stress? What food supplement?
Stress. What you take calcium, B-complex, skim milk. It helps a little bit because of calcium in it. And, you can't depend on food supplements will do everything. You got to study what factors cause stress also. Most of the stress is internal. Most of your stress is from inside. What we think the other person causes stress, it turns out that you already stressed enough from inside, you cannot take any more stress from outside. So you have to check your blood sugar, you have to check your adrenal functions, you have to check your hormones, your lifestyle, and many other things. And I mentioned before sleep and exercise and all of that helps, but if it doesn't work, you really have to sit down with somebody and talk. Okay, please. That's right.
How do you treat if your thyroid gland is removed? What kind of nutrients does your body need?
If your what?
Thyroid gland is removed.
If your thyroid gland is removed, you have to take thyroid hormone. Any gland removed cannot be replaced. No gland can be replaced. You can take, like the lady said, what kind of food can I get estrogen? It doesn't matter if you get it from the food or get it from a pill. You have the same effect. But it takes about, sweet potatoes, for example, have estrogen. It takes 50 sweet potatoes a day to give you estrogen. We're going to be realistic here, How much? So we have to be realistic. I think we're going to have to give what is needed, and that's it. Yes.
If you're already taking vitamin D, which is a natural blood thinner, would it not be necessary to take an aspirin a day as they're teaching now? They both do the same thing?
I'm going to give you my statistics. My patients who are taking vitamin E alone, they do not need aspirin. But the patient who have high LDL and have coronary artery disease already, or have almost a heart attack with regularity, we take precaution, we give it an aspirin and vitamin D. Just a precaution. Just the fear of stroke, because stroke is a very disastrous feeling to have a stroke. Yes, ma'am.
The glands of the produce testosterone and estrogen and progesterone, is there any kind of nutritional things you can do to help those glands produce more?
Any gland in the body, all the glands of the body, no different from any other cell. You require to have enough protein in the diet. And vegetable protein are better than animal protein. You require to eat more starches than sugar and or fruits. Because the starches adjust the blood sugar much better for those glands. You require to consume oil, corn oil, sunflower oil, not mineral oil, to help the body. important in the testosterone and estrogen in chemistry. Minerals are very important. That's something recently we discovered. That prostate, for example, they require large amounts of zinc, or the Shakti Formula 1 is important. So it must be. If you take the correlation about the discovery, the prostate needs zinc, the pancreas needs chromium, the insulin needs magnesium, and there must be a trace mineral work in those glands, but there is no paper being published yet about that topic. But I think there is a correlation. Vitamin E has been shown to help sexual problems. Maybe because it is an antioxidant, maybe because it works on the hormones we don't know yet. So you're not going to help the glands of the body alone. It has to be in the whole picture of good general health. Yes, sir.
Is there a particular gland that affects Epstein-Barr?
Yes. The Epstein-Barr virus is a virus that enters the body, and you cannot fight it due to the lack of white blood cells. That is related directly with all the glands in the body, especially the vitamin D and the calcium are the two important ones. But immune system is a lot more complicated than that. And vitamin C and other vitamins play a very important role. And in a lecture I gave in 1987 here when we talked about the immune system, right here, and we talked about chronic fatigue syndrome right here, you probably will find the answer in those. But in general, Epstein-Barr virus is no different from AIDS, from Lyme, from any infection that you cannot fight well. So if you develop Epstein-Barr virus and you didn't fight it, you're probably going to develop other viruses with it too. So general good nutrition, like I said, in the diet, and exercise is the best way to get a good immune system.
Well, what if the person's so fatigued you can't exercise?
Well, then don't exercise. Then there is adrenal exhaustion developed there, and we have to help with the adrenal gland by doing what we call adrenal stimulation. You got to get out of you can't stay there. You cannot, don't let somebody tired to the point that they go downhill. A tired person gets more tired, and more tired, and more tired, and end up by having many diseases. Fatigue is a very serious problem we deal with. And thank God in our practice, very, very few patients have fatigue or tiredness. Because once we correct the root of the problem, usually we have results. Yes, ma'am.
How can you reverse nasal polyps like through nutrition?
How can I reverse nasal polyps? You can't reverse nasal polyps.
So you can't make them go away?
No. Nasal polyps have to be removed by surgery.
But once they're removed...
Oh, to prevent a new one?
Right.
It's a tough question because I'm not ear, nose, and throat person. But I would say that a person who develops nasal polyps is a person that has problems in the nose, like allergy, sniffing a lot, having problems, maybe adrenal stimulation, maybe be sure that there is enough cortisol level in the blood, maybe be sure there is enough, I think vitamin E oil in the nostril might restore the mucosa, and if you inhale it, if you have just a little bit, and go inhale a little bit and let it run inside, it's not going to hurt you, it's not going to go in the lung. It's a tough question. If I discover that, I'd be publishing a paper about it. But I don't know. Yes.
Is vitamin B12 oral medication as good as vitamin B12 injectable?
No. Is vitamin B12 oral as good as injectable? No. The reason behind it is this. Vitamin B12, when it enters the body as a vitamin B12, there is another little chair here across from the big chair right there, with a little guy sitting on it, not as big as the other one, called releasing factor. Okay, called the factor. That factor, he is a guard waiting for B12 to come. When B12 comes, he carried B12 on his shoulder like this. And he carries all the way in the intestine, all the way down right here in the cecum, and open the cecum and into the blood with it. B12 cannot be absorbed without this factor. People have hiatal hernia, have too much stress, too much acid, too little acid, problem with indigestion, or any of the problems have a decrease of this factor. Then they require B12 injection. Definitely, yeah. Would be everything, yeah. Definitely. But out of my patients I see in general, probably 95% feels much better with B12 injection than oral. And that's not psychosomatic. When we do the B12 level in the blood, sometimes we don't get accurate results. But why do people respond so much better with injection than oral? And some of those people are doctors. So it's not psychological to them. They know it helps them. And some of them anti-vitamins. When they take it, they say, I definitely feel better. As a matter of fact, vitamins in general, if you get doctors to take vitamins and they feel so much better, they will give it to their patients. But they don't want to take it. Okay. Yes, ma'am.
I have a problem with Formula 1. I can...
Upset your stomach. Okay. Yes. Formula 1, because there's so much trace minerals in it, it can upset the stomach in some people. The best way to do it is to take it after dinner, after you eat your meal, you take one, and after lunch you take one. And you have to build it gradually, because you probably have an intestinal problem that those minerals irritate the mouth and makes it go having cramps. You get nauseated. If you take it after a meal, most likely you won't. If you still get nauseated, then we have to check the gallbladder for a gallbladder stone or cholecystitis. That might be the cause there. Yes, ma'am.
Is a hormone problem connected with endometriosis?
Yes. Some women have endometriosis. As a matter of fact, I had a patient right now who has severe endometriosis. Has a severe endometriosis. The doctor removed the ovaries, and she's 32 years old. And all the ovaries removed, and all the endometriosis pain is gone. However, the problem, I was talking to the lady right there, but estrogen deficiency started to develop in 2 years later. 3 years later, 4 years later, now she's having osteoporosis, she's having all kinds of problems. When I start giving her estrogen, yes, she's resistant, her husband resistant, I cannot go back to that pain again. But I insisted on that we have to give a little bit and see what happens. 90% of her symptoms, she is crazy, she's going to the psychiatrist all the time, all the symptoms disappear, just taking the estrogen. But the pain, we are watching for the endometriosis pain to come back. So we're going to have to maintain some level that she enjoy life without pain. But there are treatments for endometriosis right now with laser surgery that it doesn't come back. Yes, sir. In the back.
What I'm getting on everything you said tonight is that you really can't treat yourself. You should have an analysis of your body in order to...
You can. If you have a problem, you cannot treat. If you are living, having aging process going on, blood pressure, for example, arthritis, or something is wrong, and try this. You should try something. If you've been in the lectures before, when we said you should eat this kind of food, this food, this food, this food, and when we exercise and detoxify, all the stuff we have said in the previous lectures, when you apply all of that, and you still have a problem, then you go to the testing and the analysis. That's what I said. Okay? Anybody else here? Right?
I used to go to the opposite extreme and say no problem, but say for a woman after menopause. No hot flashes, no problems at all. Again, nothing was done. Is that body balancing itself, or
You got surprises coming up. Yes, you are. You will have a surprise. Because, like I said to gentlemen, you cannot guess when it comes to the normal values. There are certain normal values in the body. You have to be within those normal range. If you are out of the range, high or low, eventually you're going to have a problem. And physical examinations, blood tests, urine tests, is just as important as a test here or any of those to check. And those will tell you where is your level. If your level is normal, you might have a healthy body and you're still producing estrogen at the age of 70. Then you don't need the extra estrogen. But if you're feeling good and the estrogen is low, then the estrogen definitely going to lead to deficiency to osteoporosis and you will have surprise.
But would you have any indications such as skin getting leathery, this kind of...
No, the first symptom of osteoporosis is the dryness in the vagina, the cessation of period itself, no period. That's the first symptom. Just not having a period means that there's a problem, the estrogen progesterone ratio like that. So you can't depend on only symptoms, make a diagnosis. Okay, thank you very much and you have a good night.